So we'll move on to the next question.
Hi ma'am, I am
Hello.
Fauzia, doing BTech in KMA. I have a doubt. Sometimes most of the girls do have painful periods. Is it right to take painkillers for every month?
For these painful periods. Okay. I think this is one of the commonest problem that our young girls are
This is also one of
facing,
the common problems, dysmenorrhea as we call it.
Right.
And dysmenorrhea is of two types actually. You call it primary dysmenorrhea and a secondary dysmenorrhea. Primary dysmenorrhea is actually a very benign kind of a thing. You don't have any problem. You get your pain during the first or second day of your periods and it just goes away.
Okay.
Secondary dysmenorrhea is usually associated with some kind of a problem with
Underlying diseases, yes,
underlying
okay.
disease of the uterus and the ovaries or something like that. And so it needs to be diagnosed and treated at the earliest. So how will we know whether you're having primary dysmenorrhea or secondary dysmenorrhea? So if you're having painful periods, it means that you have to have some kind of an analgesic, usually an NSAID. That's what we usually take. If you have pain anywhere, you don't go to the doctor, you just go to the pharmacy and get a Dolo or some kind of an analgesic and you just pop in.
Yeah,
and
that's right.
usually the pain subsides.
Okay.
But you should not do like that. I'm not advising to go to the
Okay.
pharmacist and taking. That's
That
what
is the
we-
usual trend
that's
that we
the
are
usual
seeing,
trend.
right, yeah.
But this NSAIDs, which is the first line of management for dysmenorrhea, usually takes care of the primary dysmenorrhea kind of a thing. Okay, and so there is no problem in taking NSAIDs, which is analgesic drugs, for the first 1 or 2 days. That is, you
Okay.
take it 6th hourly or 8th hourly depending upon the severity of your pain.
Okay.
So I don't think there is any problem in taking unless you are having gastritis.
Okay.
You're having gastritis or
There are more chances with NSAIDs, okay.
But if you're taking the medicine for a long time, then it causes problems because it reduces the prostaglandins and can cause renal impairment, things like that.
Okay.
So for 1 or 2 days,
That
it's
means
not.
if you're taking it a stretch.
Yeah, for 1 or 2 days
Okay.
it's not a
Okay,
problem.
right, yeah.
But in secondary dysmenorrhea case, the pain starts much before the periods.
Okay.
Even 1 week before the periods, the pain starts, and it will be a dragging kind of a pain. It increases during the periods, and totally the pain will be there for 1 or 2 weeks. And so the girl would be really very much distressed because of the pain. And in such cases, you need to consult a gynecologist to see whether there is any underlying pathology. Like most commonly endometriosis or pelvic inflammatory disease, it is infection of the uterus or next say, and you have to identify the problem and get the appropriate treatment which has to be given.
So a girl with a dysmenorrhea.
Yes.
So like when do they have to go and meet a doctor?
Yes, if the girl is having painful periods and it's not getting relieved by taking simple analgesics, definitely she has to consult a gynecologist.
I mean, doctor, my doubt is like how many days, like how many months they can wait, or like on a regular basis.
Primary dysmenorrhea is very common.
Okay.
In girls who are not married, actually, it's very common. Once the ovulatory phase starts, that is after menarche, for 6 months there won't be any dysmenorrhea, and after 6 months, once your ovaries start ovulating, you tend to get dysmenorrhea. Most of the girls tend to get dysmenorrhea, and it's not a pathological problem. It's very common, and if it's distressing you, you can't do your daily activities, you can't go to school or college, definitely you can take analgesics. That's not a problem. But if it's getting relieved in 1 or 2 days, then there is no need to consult a
consecutively,
gynecologist.
how many months you can take, like with every period?
Every cycle you can take.
You can
no
take.
problem. You can take it in each cycle.
To say it's a secondary dysmenorrhea?
It's not. It will not get relieved by simple analgesics. You
Oh,
won't get
right,
relieved.
yeah,
You
right.
may have to go to the hospital, get injections. You will have very severe pain, which is not relieved by.
So other one is they'll get relief with
Yeah,
the
they'll get
analgesics.
relief.
Right. Okay, doctor. Thank you. Now let's see what this girl has to say.
Hi ma'am, I'm Ashna, doing BTech in KMA Engineering College. I heard that so many girls have irregular periods. Will it affect in future life?
This irregular periods.
Yes.
Okay.
Yeah, the question was about
Irregular, yes, irregular
irregular
periods.
periods.
Right,
yes.
yeah.
Irregular periods can be infrequent periods or it can be frequent periods. So what is the cutoff?
Okay.
Usually the cutoff is taken as between 24 and 38, it's normal. Okay.
It's not 28.
It's not, cutoff is not directly 28, and
Okay, right.
that's not like that. It's between 24 and 38. And if you are getting periods one before 24, every 24 days, you call it a frequent periods. The
Okay,
girl is
right.
having frequent periods. If it is, if the girl is having periods only after 38, 39 days,
Okay.
then you call it infrequent periods.
Okay, right.
Okay. So in
So
both, the
both these
cases,
things are abnormal.
yeah, both these things are abnormal,
Okay.
and both these things needs to be taken care of.
Okay.
Yeah. So the girl needs definitely investigations and treatment necessary to deal with the problem. So what are the reasons for this infrequent? I'll deal with the infrequent periods first. Infrequent periods, because that is the most common thing that we see. So the most common thing is the hormonal changes, mostly PCODs. You know,
Okay, right,
PCOD, polycystic ovarian disease. It's most common, and it's the most common thing. Then there are other causes like hypothyroidism, and sometimes hyperprolactinemia, that is prolactin level is very high, thyroid hormone level low,
Okay.
and things like that. And girls who tend to exercise a lot, athletic girls, that is who go for the sports event and things like that,
Okay.
their hormone levels will be a little bit low, and they will also go get infrequent periods
Okay.
and things like that.
What about this low hemoglobin level? Will it affect the periods?
No, no, no. That is the most common question that the girls and the mothers ask.
That's
That is whether the low hemoglobin, is it because of the low hemoglobin that my daughter is not menstruating regularly? It's not like that. Even with the hemoglobin of 14 or 13, you may not have regular periods. It is not related to the the hemoglobin level.
Okay.
Yeah.
So that means these girls should get investigated thoroughly.
Yes, yes. Mostly it will be due to some kind of an endocrinological problem that they will be having.
So that means the underlying disease we have to find out what does it cause actually.
Mostly in young girls who are into modeling and very rigorous diet regulations, who tend to lose weight very fast.
Okay.
And girls who don't care about these kind of things and who tend to gain weight very fast.
Okay,
Both
right.
the spectrum. These two types of girls, no, they tend to have infrequent periods. Even the lean ones as well as the overweight
Overweight
ones.
one. So doctor, we'll move on to the next question.
Hi ma'am,
Hello.
I'm Shipna, doing BTech in KMA Engineering College. I have a doubt. I have heard about polycystic ovarian disease, and I think it's common
Nowadays it's so common.
in new generation. What all care we have to take for that?
For this polycystic
Yes.
ovaries. Okay.
Okay, that is about polycystic ovarian
Okay.
disease. That was a question. And just because you're diagnosed, you're having an ultrasound scan report showing polycystic ovaries, it doesn't mean that you are affected with polycystic ovarian disease. Lots of other features also need to be there. Symptoms also need to be there to classify a girl as having polycystic ovarian disease. Okay, the most common thing would be irregular periods or no periods at all. Okay, that is the one point. And the other one would be definitely the ultrasound feature showing cystics. Cyst means a water-filled thing is called a cyst.
Okay.
And in polycystic disease, these cysts will be numerous in number than the normal ovaries. Okay. In normal ovaries, the follicular number will be less than that of the polycystic ovaries.
Okay.
And these cysts will be gathered or scattered around the periphery of the ovaries. That is the scan finding that we see in polycystic ovarian disease. And the other thing is the hyperandrogenism, features of hyperandrogenism, excessive facial hair, excessive body hair, acne, oily skin, and things like that. Or a biochemical evidence, that is a blood report that is showing high level of testosterone. Testosterone is definitely a male hormone, but it is also produced by the ovaries, and if it is produced in excess from the
Abnormally,
ovaries,
yeah.
that also is a feature of polycystic ovarian disease. Other than that, these girls, mostly they are obese girls, and they will have some kind of a blackish discoloration over their neck area, back part of the neck, and as well as their armpit.
Actually, okay, excellent. Okay.
And that is called as acanthosis, and that is also considered as a feature of polycystic ovaries. And these girls will be mostly they'll be depressed, and they will have low self-esteem because of these body features they are
Problems
having.
and, okay.
Yeah, and there will be a lot of hair fall, and because of the androgen.
High androgen level.
High androgen,
Okay.
hair loss, and as well as acne and I told you facial hair and things like that.
So, what is the line of management, doctor?
The first and the most important line of management would be a lifestyle modification. What I mean by lifestyle modification is a healthy, balanced diet along with exercise. which most of the young girls don't have, because they are very busy with their studies, they want to prepare for the entrance and things like that, competitive exams, and they don't have time for their daily routines. So how can they go on having exercise kind of a routine every day? But that is very important in case of a polycystic ovarian disease. You need to take a healthy balanced diet. What I mean by healthy balanced diet is that you need to include plenty of fruits and vegetables in your diet, and you need to take whole wheat or whole rice, that is brown rice is very good, and cut down your carbohydrate and increase the protein and
another doubt is that doctor, can they conceive later?
Yes.
Will it be a problem?
Yeah, because in polycystic ovaries, as you know, there is a difficulty in getting pregnant, because there is difficulty in ovulating. So once ovulation occurs, only there is a chance of getting pregnant. So since these girls, they are having difficulty in ovulating, they definitely will have a difficulty in getting pregnant. So in future, definitely this can carry on. If they don't do enough exercise and if they don't eat properly, they can definitely go on to have infertility in future. The most important long-term complication is diabetes mellitus, and diabetes, as you know, is a condition where there is a difficulty for the body to control the sugar levels. So these girls, they will have a family history, their parents or their uncles or relatives, anybody will be having diabetes, and they are more prone to developing diabetes during their pregnancy as well as in the later life. And another complication is cardiovascular problems, because they tend to have high BP in later life, and the diabetes along with the high BP can predispose them to cardiac problems in later life. That is long-term complications mostly.
Of polycystic ovarian disease.
And another thing is that there is an increased susceptibility to cancer, that is endometrial cancer. If you're having infrequent periods, that is less than 3 to 4 periods in 1 year, your endometrium, that is the lining of your womb, inside the womb, which is shed regularly during the cyclical periods, it tends to get thickened, abnormally thickened, and it tends to become cancerous and it can lead to endometrial cancer.
So this type of patients, do they have to be on a regular medicine or something like that?
Most important treatment for these young girls is not medicine but lifestyle modification, diet and exercise. But if they are very much worried about their infrequent periods, they're not getting periods once in every 3 months, yes, they need to take some medicine so that their endometrium, that is the lining of the womb, is protected from endometrial cancer. So we usually give progesterones. We combine it with estrogen and give it as OZPs, oral contraceptive pills, usually given for cyclical control. There is an added advantage of giving oral contraceptives, because the oral contraceptives will reduce the dysmenorrhea. If they are having painful periods, it will reduce the dysmenorrhea, it will reduce the amount of bleeding, it will give good cyclical control, that is they will have withdrawal bleeding every month regularly. So that is usually that is the line of management.
Doctor, we have a male. I am a 21-year-old girl. I am doing my engineering. My periods are really heavy and sometimes it persists for 8 to 9 days. Do I have to meet a doctor for this?
This is very heavy menstrual bleeding is a subjective kind of a thing, because you can't say who is having heavy periods and who is not having. She is saying in the male that she is having a period of about 8 to 9 days duration. But the cutoff for prolonged periods is 8 days. Between 4 to 8 is perfectly normal. And if it's more than 8, you call it a prolonged periods. So she is having a prolonged periods because she says it lasts for about 9 days. And whether it's heavy or not, because she's saying it's heavy, we have to believe, like it's a subjective kind of a thing. Because if it is affecting her day-to-day physical, mental kind of a thing, daily routine is being affected by this heavy menstrual flow, definitely she needs to get some kind of a treatment for this. She needs to get investigated, and then definitely treatment has to be taken for this.
So first thing, I think she has to go and meet a?
Yeah, definitely she has to meet a gynecologist.